Assalamu alaikum. Can you hear my voice? Can you hear me? Assalamu
Yes, yes,
alaikum.
doctor.
Yes,
Assalamu alaikum. Yes.
Okay, okay,
salam.
okay. We'll wait for a few minutes. Let the students join. So later we can start. Okay. Can you see my screen? I have shared a screen. Can you see the screen?
Yeah, yes, doctor, we can.
Okay. Just we'll wait for a few minutes because students are joining. Okay. Only 19 students have joined. We will wait for a few minutes and we'll start the class. Okay.
Okay.
Good evening and salam alaikum. So, hope all of you can see the slides properly. Can you hear my voice? Is it audible?
Yes, yeah, doctor.
Okay, thank you. So, if you have any questions, you can ask me at the end of the class, or if you have any questions in between, also you can ask me. No issues. Okay. So, today we are going to study the radiological anatomy of the upper and lower limbs. What does it mean? So,
Uh,
basically, today,
Excuse me, Dr.
yeah,
Vikram.
tell
Uh,
me.
could you please record the session?
I think it's not possible now. It's not possible.
Okay.
Okay. Radiological anatomy of upper and lower limb. So basically today what we are going to study is X-rays related to upper limb and lower limb joints. Okay. So in the upper limb, basically we have got the following joints: the shoulder joint, the elbow joint, wrist joint. Other than this, we have got lot of small other joints, small joints in the hand. So whenever it comes, I'll show you with the diagram. We can discuss about the small joints of the hand. So first coming to upper limb joints, as I told you, so we have got the shoulder joint, elbow joint, wrist joint, hand, and the small joint. So in the hand, we have got smaller joints. Next, so in this, we are also going to name the bones and study little bit of each bones, the relative parts of the bone which take part in the articulation. Articulations means formation of the joint. Next, coming to lower limb. In the lower limb, we have got the following joints. You all know this: hip joint, knee joint, ankle joint, foot, and small joint. So small joints, they are called the tarsal joints. So in the foot, we call them as tarsal and metatarsal. So in the upper limb, that is in the hand, we call them as carpal and metacarpal joints. Metacarpophalangeal joints, carpometacarpal joints, all this, whenever it comes, I'll tell you about this. So, and also, as I told you, we are going to very briefly, we are going to name the bones of the lower limb also. So let us see what can we see in the X-ray. What can we see in the X-ray? So now you are seeing a picture. So the arrow is pointing an X-ray. So the right one is an X-ray without any label. So in the clinic, so whenever you are practicing in the clinic, now you are studying the basic sciences. So in future, you are going to hospital side. In the hospital side, you may get an X-ray like this. So now the intention is you should be able to read the X-rays in future. That's why you are knowing the basic joints and bones of the upper limb as well as lower limb. To this will make you help in reading the X-rays in future. So in this diagram, you can clearly see, so this is the humerus. So then this is the scapula. So scapula is joining with the humerus. So this joint, we call this as shoulder joint. You all know this is a ball and socket type of joint, and maximum mobility is possible in this type of joint. Now let it be like that. So now we are concerned about how to read this X-ray. Whenever X-ray comes to your hand like this, X-ray will be like this. So you have to identify whether it is right or the left. So in this X-ray particularly, it has not been mentioned right or the left. So, but here in the next X-ray, I'm showing you
Doctor,
here. Yeah. Can you hear me? Yeah.
uh,
Tell me.
yes, the slide, it's on the first slide. I think
Yes. Yeah. Tell me.
Yes, doctor. We mean your slides and your presentation is frozen, not moving.
It's not moving now.
No.
it's still on the first slide.
Still in the first slide. Okay. Let me check it once. I'll just stop sharing and I'll reshare it. Now, can you see the slide?
Yes.
Yes.
Yeah, now
Yes.
first slide. So I this is the slide number 2. Next, going to slide number 3. Okay, I hope you can see this. So I'll not make it full
Yes.
screen. If I make it full screen, it may not scroll. So in this X-ray, what you are going to study is, so this is the shoulder joint. This is between the scapula and the humerus. So glenoidal cavity of the scapula, so is articulating with the head of humerus to form the glenohumeral joint. This is also called the shoulder joint. So in this X-ray, what you are going to study? See, first, whenever X-ray comes to your hand, so you try to find out so which side it is. So from the slide number 4, you can see here they have mentioned R. R is right side. So in some other slide, when we go down here, you can see it is L. L is left side. So coming back to the first slide with the diagram. So here it is not mentioned, but usually most of the X-rays it will be mentioned. You have to identify the side of the X-ray, right or the left. Next, there are some views on the X-rays. The basic views are antero-posterior view. Antero-posterior view, the X-ray is passed from the anterior aspect and the X-ray film is placed behind. So this view we call it as antero-posterior view. So what you are seeing, this X-ray, that is the X-ray of the shoulder joint, most of the time it is antero-posterior view. So first you are telling, so which side it is, side is not there. Then what is the view? This is the antero-posterior view. Next, you have to identify whether it is plane or contrast. Now, coming to this, what do you mean by plane X-ray? What do you mean by contrast X-ray? First, plane X-ray, there is no other material used. No other material used. So, in contrast X-ray, some dyes like iodine, Conray 40, these are some of the examples. So, X-rays with the dye, they are called the contrast X-rays. Where do you use contrast X-rays? See, in the bones, usually we don't use any colors. Any dye means color. So we don't use any dyes in the normal X-ray of the bones. Okay. So usually when we visualize the arteries of the heart, that is coronary angiogram. So angiogram is done to visualize the interior of the arteries. So in this case, we inject a dye through through the blood vessel. Then series of X-rays are taken to see where exactly the block is. So this type of X-ray, this is one of the example for contrast X-ray. Then we have got a renal angiogram, venograms. Inside the veins we inject some dye and we take the pictures. Then pylography. So all these you are going to study whenever it comes. So this is a difference between plain and contrast X-ray. Now in this slide, whatever you are seeing, this is the plain X-ray. All these slides of the upper limb, what we are going to discuss today, they are called plain X-ray. Let me come back. So first what you are seeing, so it is plain or contrast you are telling. What is the view? It is the anterior posterior view. Then you are going to name the bones here. So this one, this is the head of the humerus. So greater tuberosity, lesser tuberosity. This is the glenoidal cavity or the glenoidal labrum. We call this as glenoidal cavity, which is deepened by means of the glenoidal labrum. So this is the glenoidal cavity. So here you are seeing other parts of the scapula, that is the coracoid process. This is the acromion, and here you are seeing the acromioclavicular joint. Acromioclavicular joint. So this is the glenohumeral joint. Basically, you should know the bones. So they may ask you, what is this bone? What is this joint? So you should know all the bones which take part in this joint. So coming to the next X-ray, so we have studied the glenohumeral joint or shoulder joint. Now coming to the next X-ray, clearly you can make out this is an X-ray of elbow joint. Elbow joint. So what are the bones in the elbow joint? We all know above it is by humerus and below it is by radius and ulna. Above by humerus, below by radius and ulna. As I told you, again, when you are reading an X-ray, you should identify which side it is. So here you can easily identify it is the right side. What type of X-ray it is? Plain or contrast? Can you answer? This is plain X-ray
Plain.
or contrasted? Yes, very good. This is the plain X-ray. So what view? I will tell you the views. So this is the antero-posterior view. The arrow is pointing antero-posterior view. What are the other views? So this, the second half of this picture. So here you can see this is called the lateral view. So this is the anterior-posterior view. This is the lateral view of the elbow joint. So this is humerus, this is the radius, and this is the ulna. So this joint we call this as elbow joint. Here also you can see the ulna, the olecranon process of ulna here, the head of the radius, and this is the humerus. So this is the elbow joint. So basically in the X-ray you should be able to identify the joint and what are the bones taking part in the joint. So next, coming to in detail, what are the parts which are involved in the formation of the joint. So in this joint you can make out, so this is the posterior view. In the posterior view, you are seeing this fossa on the posterior aspect of the humerus. We call this as olecranon fossa. This is called olecranon fossa. So here there is articulation of olecranon process of ulna. Olecranon process of ulna articulating with the olecranon fossa of the humerus. What are the other things we see here? Capitulum is articulating with the radius, head of the radius with the capitulum. Then we have got coronoid process of the ulna, and this is called the trochlea. So coronoid process, trochlea. So this joint we call this as elbow joint. This is the lateral view. You can see the olecranon process. Olecranon fossa will be deep here. This is the capitulum. This is the head of the radius. This is the lateral view. This is the anterior-posterior view. But what you are seeing, this fossa is on the posterior aspect. So if you come to the next diagram, the arrow is pointing. You are seeing some of this here. So what are these actually? So these structures are not fully developed. So they are marked here. So they are called epiphyses. If they are not fully developed, so they are called epiphyses, epiphyseal ends. So which usually in children they will not be developed properly. But in the adult bone, you can see here all the centers are developed and the joint you can easily make out. Coming to the next diagram, normal X-ray, X-ray you are seeing. So same thing, whatever I told you. So in detail, it has been explained. So here you can see here. So this is the shaft of the humerus. So in the humerus, we have got two ends. We call them as condyles. Over the condyles, the tip of the condyles, we call them as epicondyles. Epicondyles will be in this region. So this is the olecranon fossa, and this is the olecranon process of the ulna, head of the radius. So same thing have been explained in all these diagrams. You can just go through them. So humerus. So this is the supracondylar ridge. Above the condyle there is a ridge. It is called supracondylar ridge. This is the olecranon process. So here one more part you are seeing. This is, there is a part called trochlea. The notch we call this as trochlear notch. So already you might have studied in detail when you are studying the bones. So shaft of the radius and ulna have been shown here. This is the shaft of the radius and this is the shaft of the ulna. So here this is the head of the radius. This is the olecranon process of the radius. So other than this, so whatever parts you are seeing, you can see here. So this is the capitulum articulating with the ulna. You can see here. So here anterior pad of fat will be present. So it's not seen clearly. Only the bone you can see clearly in this picture. So olecranon fossa, again the arrow pointing the olecranon fossa, and this is the olecranon process. So this is about the elbow joint. So let me tell you once more. So whenever if you get an X-ray like this, you have to identify whether it is plain X-ray or contrast. So whenever there is fracture or dislocation, most of the X-rays will be plain. It is not contrast X-ray. You have to identify which are the bones taking part in the X-ray, what are the joints you are seeing in the X-ray. So you have to tell whether it is right or the left X-ray. And very important thing is anterior-posterior view and the lateral view. What all possible views in each joint you should remember. Next, so next coming to the wrist joint. The wrist joint. So you can see here clearly, already you know this. So the wrist joint is between the radius, that is the lower end of the radius, and the carpal bone. Radius and the carpal bone, they form the wrist joint. Ulna doesn't take part in the formation of the wrist joint. Ulna forms a joints with the radius, so lower radio ulnar joint. This is lower radio ulnar joint. The wrist joint is between the carpal bones and the radius. So you all know what are the carpal bones. There are two rows of carpal bones, the proximal and the distal row. You can easily remember them. So this is scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. So there is a mnemonic. If you search in the internet, you will get. So it's very easy. You can remember with the mnemonic. So many mnemonics are available in the internet. So it is easy to remember this bone. After this, so we have got the metacarpals. So this is the first metacarpal, that is at the base of the thumb. So or follex, we call this thumb as follex. Second metacarpal, third, fourth, and fifth metacarpals. So you are seeing whatever you are seeing. So this is called the base of the metacarpal. So this is the proximal end. At the distal end, you get the head of the metacarpal. It is not seen in this picture. Whatever you are seeing, this is called the shaft of the metacarpal. So metacarpal base and metacarpal shaft. So if you know the normal X-ray, it is very easy to identify the abnormal. See, in this X-ray, usually what you have to concentrate is, you have to concentrate this radius. You can see here, the radius is normal. There is no fracture. Usually this part, most of the time there will be fracture. And then here scaphoid, you are seeing this scaphoid. There may be fracture here. So this part, we call this as waist of the scaphoid. Sometimes there may be fracture here, and fracture may be present in any other bones also. I'll show you how to identify the fracture in next few slides. So this is a plain X-ray. There is no contrast medium used, and this is the anterior-posterior X-ray. So next, coming to the lower limb, you are seeing here. So what do you call this joint? This is called the hip joint. Hip joint is between the innominate bone or the hip bone and the femur. So this is the innominate bone or the hip bone, and this is the femur. Just 1 second. Okay, sorry. Coming back to the slide. So you are seeing this joint. This joint, we call this as hip joint. In this joint, so the innominate bone or the hip bone articulates with the femur. So this is the head of the femur, and this is the acetabulum of the hip bone. We all know there are different parts of the hip bone. So this is the ilium. So this is the ischium. To elaborate, this is better, I think. So in this diagram, you can see this is the ilium, this is the ischium, and this is the pubis. In this diagram, you are seeing the pubis, the ischium, and the ilium. This part is called the acetabulum, where all the three bones they meet. Ilium, ischium, and pubis. They meet in this part. This is called the acetabulum. So head of the femur articulates with the acetabulum of the hip bone. So this is called the head of the femur. So here this is the neck of the femur, greater trochanter of the femur, lesser trochanter of the femur. So here this is the shaft of the femur. So the hip joint is between the head of the femur and the acetabulum. So same things have been given here. You can go through them. So in the posterior aspect, you are seeing the sacrum. So this is the sacrum. So what is this fovea? On the head of the femur, there is a round, round structure that is called fovea, where the ligament of head of the teres is attached. So regarding the ligament of head of teres, it is very important. So this ligament of head of ligament of head of femur. So this has got an artery. This has got an artery. By chance, during accident or due to some other reason, if the ligament is damaged, So the artery or the blood supply to the head of the femorus will be destroyed or will be stopped. In this case, the head of the femur will go for necrosis. We call this as avascular necrosis. You are going to study them in detail later. So avascular necrosis, and there will be a fracture in this area. So usually it may occur due to injury or in old age, old degenerative diseases. So there may be damage to the ligament as well as arterial supply to the head of the femur. So you should know in the exam which are the bones which go for avascular necrosis. One of the bone which goes for avascular necrosis is head of the femur. This can be asked in your exams also. Next, coming to the knee joint. So this is the X-ray of the knee joint. So here you can before this, let me go back to the slide back. So here you are seeing this is the anterior-posterior view. So this is the anterior-posterior view of the hip joint. So this is the anterior-posterior view of the hip joint. Whole of this we call this as bony pelvis. So this is the sacroiliac joint. Here we have got sacroiliac joint between the sacrum and the iliac bone. This is the sacroiliac joint. So this is pubic symphysis between the two pubic bones. There is articulation. We call this as pubic symphysis. Again, this is a plain X-ray anterior-posterior view. Next, going to the next diagram. So in this diagram, you are seeing an X-ray. This is the anterior-posterior view. And here down, what you are seeing, this is the lateral view. Same thing. So in this, you have to tell whether it is a plain X-ray or contrast. Easily, it can be made out. This is a plain X-ray showing the lower end of the femur. This is the tibia and this is the fibula. So lower end of the femur, tibia and the fibula. So in the lower end of the femur, you are seeing the condyles. At the end, these are the condyles. At the tip, these are the epicondyles, medial and lateral epicondyles. And here, this is the, the upper bone is the femur and the lower bone is the tibia. So condyles of tibia articulate with condyles of femur to form the knee joint. So this is intercondylar area. This is the intercondylar area which is having intercondylar ridges. So here you all know in this joint there are structures called menisci which cannot be clearly seen in the X-rays, but they are the cartilages which are present over the upper part or the upper articulating end of the tibia. So here they are called menisci. Medial and lateral menisci will be present. This is the lateral menisci and this is the medial menisci. So in the lower part of this X-ray, you can see a small bone here. This is the fibula. Fibula articulating with the tibia, tibiofibular joint. This is the upper tibiofibular joint. Next, coming to this diagram, in this diagram you can clearly see this is the lateral view of the X-ray showing the upper part of the bone, that is the femur, and this is the tibia and this is tibia, fibula, and you are seeing one more small bone which is called the patella. So this is the patella. So in this bone, in this picture where the arrow is pointing, you can see the shadow of the patella. Patella is a sesamoid bone which is formed in the tendon of quadriceps femoris. So intercondylar areas with intercondylar ridges. So these are the menisci, and here you are seeing the patella. Next, coming to this diagram, it's an enlarged diagram showing the knee joint. So this is the upper articulating bone, which is the femur. So here you have the condyles of the femur. Over them, we get the epicondyles. This is the lateral epicondyle. On the other side, you will be having the medial epicondyle. So patella is clearly seen articulating in the knee joint, and so here you are seeing the tibia and the fibula. So I want to remind you, so patella is a sesamoid bone which is seed like bone which is present in the tendon of quadriceps femoris. Next, coming to ankle joint, you are seeing this. So this is the ankle joint between the tibia. You are seeing here tibia and the fibula and the talus. So the bones of the foot, we call them as tarsal bones. Talus is one of the tarsal bone. Talus articulate with tibia and fibula to form the ankle joint. So again, this is a plain X-ray, lateral view. There is no contrast medium used. So the bones we are going to study in next few slides. So this is the anterior-posterior view. This is not lateral view. This is the anterior-posterior view. You can see here, this is the ankle joint. So lower end of tibia and fibula, then the tarsal bones, metatarsal bones, and the phalanges. So coming to this diagram, you can see here. So here, this is the tibia. The other side, you'll be having fibula. Next, talus, calcaneum. This is navicular, cuneiform. So there are three cuneiform: medial, intermediate, and lateral. Only the medial cuneiform you are seeing in this view. This is the first metatarsal, the metatarsal of the great toe, the metatarsal of the great toe, and these are the phalanges. So on the other side, you are seeing the fifth metatarsal. So metatarsal bone of the little toe, partly seen in this diagram. Next, so here in this diagram, so all the structures are named. You can have a look at this. So this is the lower end of tibia, lower end of fibula here. This is the talus, calcaneum, navicular, cuboid. Cuboid is on the other side. So I told you three cuneiform: medial, intermediate, and lateral cuneiform. Starting from the great toe, this is the great toe side. So here the first metatarsal, second, third, fourth, fifth metatarsal. So here the part of the metatarsal which is articulating with the tarsal bone, we call them as base of the metatarsal, and the other end is called the head of the metatarsal. The head of the metatarsal articulates with the phalanges. So this is the phalanges. The head of the metatarsal articulates with the phalanges. So in the great toe, we have got only two phalanges, the proximal phalanx and the distal phalanx. So in other toes, we have got three phalanges: proximal, intermediate, and the distal. Three phalanges are present. So here you can see, so there is a joint. So this joint we call it as metatarsophalangeal joint, and this is interphalangeal joint. So again, in the second toe, we have got proximal and distal two interphalangeal joints. Already you know this. So this is just to name the bones. This diagram will help you. So in the next diagram also, see all the bones have been named. You can just go through this diagram. So it is just a repetition of the previous. Now coming to some X-rays with some pathologies. So we can see this. This is the wrist joint. I told you this is the radius. This is the ulna. And in this view, you can see here there is some crack. There is some fracture. So fracture at the lower end of the radius. So in the lateral view, you can see very nicely this fracture is highlighted. You can see this highlighted fracture. So what is this? This type of fracture, we call it as Colles fracture. This is Colles fracture, commonly seen in old age due to osteoporosis. Old age women is commonly seen due to osteoporosis. And here you get fracture of the lower end of the radius as well as other bones of the wrist are also may also be fractured. Here you are seeing a typical deformity. This deformity we call it as dinner fork deformity. What is dinner fork? The fork what we use to eat during the it is a spoon. It is a metal spoon which we use to eat the fruits. So it is like a dinner fork. It is like a spoon. So this we call this as dinner fork deformity. You can check in the internet. So this is called Colles fracture. Just this is an example of the fracture. Now in this case, what can be done? The surgeries, what they will do. So this is the plate. This is the plate. So or clamp which can be fixed between the shaft of the radius and the head of the radius. So the clamp has been fixed. So this may be permanent fixature or it may be it later it can also be taken off. So in this diagram, in the next diagram, we can see here, so there are some nails. These nails, usually we call them as K nail, K wire. We call them as K wires. So these are the metal nails which are used for small bones of the wrist or of the toes, and also the distal end of the radius and ulna in case of fracture. You can see this. So the K wire or the nails have been used to repair the fracture. So this will support the structure till the fracture heals. Next, in this diagram, you can see here, so this is the elbow joint showing the dislocation of the elbow joint. So this is the ulna, this is the humerus. So the head of the olecranon process of the ulna is dislocated from the olecranon fossa of the humerus. So this is dislocation at the elbow joint. So you should know some of the basic things. So here, here also you can see here. So these are the uh, one second. Yeah, radius and ulna here. This is radius and this is ulna. This is the humerus, and you can see shaft of the humerus. So this is shaft of the humerus. There is fracture. Fracture of the shaft of the humerus. Next, so this is the femur, head of the femur, neck of the femur, greater trochanter, lesser trochanter, and this is the shaft. So here there is a fracture at the upper end of the shaft of the femur. So this is fracture at the upper end of the shaft of the femur. This is the acetabulum. So you can see the fracture here. Next, coming to this diagram, so this is the X-ray picture taken after the repair. So this is the artificial hip joint. It is a metallic hip joint. You can see here. So we call them as artificial prosthesis. We call them as prosthesis. So the head of the femur, neck of the femur, and a part of the shaft of the femur is being replaced by a metallic prosthesis. So this is an artificial material. So this is usually it will be metallic, non-reactive materials are used here. So to repair, this is usually done in case of degenerative diseases like osteoarthritis or in rheumatoid arthritis. So where the head of the femur is completely degenerated, or in case of avascular necrosis of the head of the femur. So this type of replacement, this is called joint replacement, hip joint replacement, and knee joint replacement. You might have heard. So these are very common nowadays. So they will check whether the patient is fit for surgery. If the age permits, if the medical fitness permits, then the patient can go for replacement surgeries depending on doctor's advice. So with this, we complete today's class. Hope you understood. So let me repeat once more. The main thing what you have to know in this X-rays is, so you have to name whether it is plain X-ray or contrast X-ray. Then you have to tell whether it is anterior-posterior view, lateral view, or some other view like oblique view. Then, if possible, whether it is right side or left side, then you have to identify the bones which are involved in the X-ray, the joints which are involved in the X-ray. So with this, we end our class. So you have any questions, you can ask.
Doctor,
Yes, tell me.
in slide 11, there is something in the first metatarsal.
Wait, 1 second. Let me go back.
In this
Here.
picture.
Yeah, this
Yeah.
one. Yes, exactly right. Very good.
Is this
So,
deformity?
sesamoid. Sesamoid bone. It is the sesamoid bone.
Okay.
They are small sesamoid bones in the tendons. Okay, it's not. It doesn't look like pathology. But see, let me tell you. This is the basic foundation courses, musculoskeletal course. It is also a foundation course. So here you need to know to differentiate the normal and abnormal. So these things, this is normal actually. Sometimes it may be present, or sometimes it may not be present.
So, doctor, that's it's a pathological condition that's it's abnormal.
Yes, pathological means abnormal. See, physiological means normal, pathological means abnormal. So, here in
Yeah.
anatomy, so we are going to study the normal structures. When you go to pathology or even the clinical side, so you have to differentiate which is normal and which is abnormal. That's why we showed you some slides where the fractures and other pathological structures are present.
So, doctor, the underdeveloped elbow joint in the slide 4, is it
Yes, yes,
physiological
yes.
or pathological?
No, it is seen in children, small children. So it is they are called epiphyseal joints. So which are not completely formed. So that is physiological, normal.
Okay, thank you.
Okay, thank you. Any other questions?
Yes, doctor.
Thank you.
Yeah, yeah. Tell me.
All the pictures in the slides, all of them is plain X-ray.
Yeah, all of them are plain X-ray. Let me tell you, whenever the bone X-rays are taken, majority of them, see, not only here, in future also, whenever the bone X-rays are taken, majority of them are the plain X-rays. No dye will be injected here. Clear? Is it clear?
Yes, thank you, doctor.
Okay, thank you. Okay, with this, I hope all of you understood. With this, we'll stop sharing the slides and we'll end the class. Still, if you have any doubts, you can ask us in the practical sections. Okay, thank you.